Hello, my name is Dr. Mabel Falguera, and today we're going to talk about occipital neuralgia. This is an intense pain that patients often feel in the back of their heads and necks, and also this pain can radiate to the front area of the head. This is related mainly with the occipital nerves, named the greater, the lesser, and the third occipital nerve. The neurologists, they usually treat this condition with different medications, but in some patients, this is not going to work. For these patients, we have an option: occipital nerve decompression or neurectomy surgery. What does science say about this surgery? The latest papers and reviews says that with this surgery, you can get an improvement of at least a 50% in your pain score in most of the patients, more or less like between 80 and 90% of the patients that receive the surgery. These results are mostly achieved with greater occipital nerve decompression, a technique that consists in removing all facial, muscle, or scar tissue of the nerves, but preserving their integrity. And in that way, we will avoid the numbness on the back of the head. The possibility of cutting the nerves is mainly considered for the lesser and the third occipital nerves. The greater nerve is preferred to be decompressed in most of the cases, since excision will result in numbness in an important area on the back of the head, and more importantly, this surgery is not going to guarantee better results than the compression in many of the cases. So, after medical evaluation of the patient, the surgical plan will be detailed about which nerves are going to be treated and how. And this plan we will discuss in detail with the patient. So the best thing about occipital nerve surgery is that when it's carefully indicated and specialized after specialized medical evaluation, it's a very safe surgery. Complications are not frequent and they are usually mild and temporary. The scientific evidence is clear and extensive. This surgery can improve the quality of life of those who suffer from occipital neuralgia, and these results actually it's what I'm seeing in the patients that I have operated until today.